Hello guys, welcome back to my channel. Thank you so much for clicking on this video. My name is Victoria Ajadi and I am a UK registered nurse. In today's video, I'm going to be sharing with you the differences between the NHS hospital and the home care here in the UK. Oftentimes you find it difficult, to make that decision of whether to work with the NHS or work with the home care, or whether you just want to have more information about this. I've actually got a lot of questions about the differences and which one is preferable between NHS and home care. And someone actually got to the extent of asking me that I should advise her as a sister or as a very good friend. And in this video, I'm going to be trashing that. So please make sure to click on the subscribe button below and tap the notification bell beside it so that you don't get to miss out of any of my future videos about nursing in the UK. So the NHS hospitals are government-owned hospitals here in the UK, and it's just like any other big hospital in your country. They have different specialties in the hospital. So there are different units. Let's say there's the respiratory unit, there's the CCU, there's the children's department. That is the NHS. But for the home care, for the care home, it is mainly elderly, caring for the elderly patients. It might be nursing care, it might be just for residential and dementia. There might be dementia patients. So when you're working with the NHS, you're working with the government, and when you're working with the care home, you are working with a particular company that has a care home. I hope you understand the drift. Care homes are not owned by the government, they are owned by individual companies that recruits. So NHS recruits, and the care homes also recruits. The first thing you want to note is your specialty. What is your specialty? If you have a specialty back in your home country, probably you are a critical care nurse and you want to continue being a critical care nurse. Of course, it's advisable that you work with the NHS. And if you do not have any specialty yet, like a general nurse, and you can also work with with NHS, and you can also decide to work with a care home. So let's start with career growth and nursing skills development. Now, when you're in a NHS hospital, you get to work in different units, or at least interact with other professionals from other units, and you are able to use some equipments which are not used in a care home, obviously because it is only for the elderly. So in an NHS hospital, you get to experience different units. When you work in an NHS hospital, you've got the opportunity to grow career-wise. There are a lot of trainings going on every time. They are constantly building you up, helping you to train more and to know more on the job. It is also the same in care home, but NHS hospitals are much more bigger on trainings and career development compared to the care homes. Number 2, work pressure. I've learned that work pressure for NHS nurses is very, very high. So if you work or you're planning to work in an NHS hospital, be ready to work. Be ready to work. The work pressure is medium to high, while for the care homes, the work pressure is actually low to medium. So the work pressure for nurses working in NHS hospitals can actually be very, very high, and I mean higher than those working in a care home. Number 3 is benefits. Now, there are a lot of benefits that are available to NHS nurses. Lots of benefits, like they get discount cards, discount codes for buses, for restaurants, for hotels, and for all those good stuffs. NHS employees got all those different kind of benefits, while for care homes it is not always the same. Like I said earlier, that care homes are actually owned by individuals or by companies, so it is at their discretion to actually give discount codes for certain services to their staff. But for NHS employees, it is a constant. they enjoy that benefit. Number 4 is the wage. There's I won't say a very huge difference, but there's a difference between the NHS pay and the care home pay. Now, NHS nurses earn between 11 to 13 pounds per hour, while nurses in the care home earn between 15 and 20 pounds per hour, depending on the company that recruited them and depending also on what was stated in the contract. Finally, the other benefits. There are other benefits that the NHS employees, the NHS nurses actually enjoy that the nurses in the care homes don't get to enjoy. Something like the sick pay, like the sick leave pay. I learned that the NHS hospital nurses can actually have up to 60 days sick leave with full pay, whereas in a care home it varies. It actually varies. In fact, a care home might not even pay you up to a week for sick leave, except probably you have a doctor's report or you're admitted in the hospital or something like that. And also NHS pays big for maternity leave. The NHS hospital pays and the government also pays, whereas for nurses in the care home, they only get to be paid by their companies, not by the government, and the pay is not statutory. It actually can fluctuate. So here is a diagrammatic representation of some of the benefits and the differences between the NHS hospital and the home care, the care home. So you can also look through it and make your choice. So you can actually look through it for more information. So actually there is no right or wrong in choosing whether you want to work with the NHS or you want to work with the care home. It actually depends on your passion. It depends on what you want. It depends on what you really want as a person. So ultimately, if you want career growth, you want to go up the nursing ladder, of course, go for NHS. Thank you so much guys for watching. I hope you enjoyed watching. Please make sure to share this video in your nursing group. It will help somebody who is actually contemplating which or which not to choose. Thank you so much for watching. Please leave me a comment in the comment section. I would love to read from you. And if you have any other information about this particular topic, please also leave a comment in the comment section. Let's learn from you. Thank you so much guys for watching. Until next time when I see you in my next video. If you actually have a video request, please let me also know in the comment section and I'll be glad to take it on. Thank you so much. See you later. Bye.